Time 6 minutes I'm keeping. You can start. So Dr. Muzna and Shri Devi, start.
Good morning.
Good morning, doctor.
This is Dr. Muzna. Mustafa, you must be knowing me.
Yes, doctor. I know you. I have attended so many rounds with you.
Yes. And even you're a keen and an enthusiastic student who always wants to learn. So as far as I know, Mustafa, you want to learn something about a new case that you have seen, that is autistic spectrum disorder.
Yes, doctor. Today morning, doctor, I saw one case in the round. Actually, the child came with fever, and he is admitted here, and they were talking about the autistic spectrum disorder. So I have doubt, doctor, about this because I heard about it, but I don't know anything much about this disease.
Okay, Mustafa, very nice that you have come. Just at the outset, I would like to ask you that would you like any of your other colleagues to attend this discussion so that they can benefit?
No, doctor. Actually, no one is here now. We can discuss. I will give the information to them.
Okay, that's great. So Mustafa, what exactly have you read or what you have seen in that patient that about autistic spectrum disorder? Anything that you have read or you have seen unusual in that patient?
Yes, doctor. Actually, in the morning rounds, they were discussing like these disease. They have some problem with the communication.
Very good.
Yeah, and also with some speech problem because this child was not normal. You know how the other children they communicate, not like that.
I really appreciate your observations, Mustafa. So let me just complete your thing which you observed was right, that they do have, you mentioned about one area, that is communication, okay? The other area where do they have problem is the social area, that is interaction with people, okay? Their day-to-day interaction. And the third place where they have an issue is like I'm drawing 3 circles over here, okay? Or okay, you can draw a triangle with communication in one place, the interaction, the social interaction, and third, they have some behavioral issues. Now, you saw the communication, Mustafa. So, in communication, can you tell me the 2 forms of communication that we have?
Yeah, doctor. This we have this verbal and non-verbal communication.
Very good. So the verbal ones is actually like talking to someone, responding to someone. So what verbal part did you see in this patient?
Actually, in the rounds, I saw he's in a corner. He's sitting, doctor, and he's playing with a toy. And he was not at all bothered what we were doing. He was not talking also.
Yeah. Means no interaction at all, no communication at all. So that can also be a part of autism. Absolutely no verbal outputs that will be there. Non-verbal forms, can you just elicit that? Can you see?
Yeah, non-verbal means like how they are reacting. So and that also I like no, he was not at all reacting. We were 4 or 5 doctors talking there. He was not at all looking at us.
Yeah, so no eye-to-eye contact, no facial expressions, okay, not pointing out to his needs, not showing any interest in anything. The other interactions is about the second part, social interaction. Like they will not understand, your hidden things. They will not understand what is appropriate and inappropriate. A person with autistic spectrum disorder may just come and stand very close to you. You may not understand that is inappropriate socially, or the interaction forms, he is absolutely socially sharing. All these things are not there, right? And behavioral, did you see any behavioral things in Mustafa? Any behavioral issues?
No, actually, doctor, I was there for 5-10 minutes, so I didn't notice anything like that.
But do you know any behavioral problems that they can have?
Yeah, in the rounds they were discussing like they have some like no repetitive movements and all.
Very good. Yeah, like head banging, stimming, hand flapping, right? And they can even have these tantrums. They can even be associated with hyperactivity disorder. Regarding this patient, you remember he was refusing to do vinipuncture, and he has a sensory processing disorder. So, Mustafa, did you read anything about this?
No, I don't know about this, doctor. Actually,
Okay.
that child, very high temperature, and
Huh.
it's really difficult to, like, no, already admitted child, and without IV cannulation, actually, all
Mhm.
were too much worried, like what to
Yeah.
do with this child. So
So
how can we
Mustafa,
help, and why he is doing like this, doctor?
yeah, Mustafa, I can see the concern that you have for this patient. You know, I appreciate that. So basically, this is your worry, and this is something that you want to learn, right? Or there's any other concern about autistic spectrum disorder that you have?
Yeah, I want to know about this, and I have other
Yeah.
concerns also, doctor.
Okay, so first we'll address this concern and go ahead with the other one, right?
Yeah.
So the sensory
Yes.
processing that they are, you know, what happens is an autistic spectrum disorder. Do you know that like you must be knowing that they have a lot, they can be oversensitive as well as undersensitive to many stimuli. Like, which are the various sensory stimuli that we have around us, Mustafa?
Yeah, doctor, like touch,
Very
then
good,
taste, the
very
smell,
good, excellent.
the
Yeah.
sight and hearing. Yes, doctor.
So all these things, some children are very sensitive, a little amount also, like this child is very sensitive to the touch thing. That's why he's just not allowing for the venipuncture probably, right?
Okay, doctor.
3 minutes left. Three
So
minutes.
how we can help, doctor? What we can do so that he will come out of it?
See, that is something I appreciate in you, Mustafa. You're so concerned and you want to learn about this, right? So there are certain therapies for this sensory processing disorder as well as these autistic children. You know, they have to be given the sensory integration therapy. Do you know about this?
No, doctor, I don't know.
Okay, so I'll just help you. I'll sensitize you, and then you can read something more about that also. That there are special therapists, you know, who over a period of time, in a playful manner, kind of sensitize these children to those senses which they those sensory things which they don't like. For example, if they are very sensitive to touch, or very sensitive to some sound, so slowly in a playful manner uh, uh, they will kind of expose these children in small chunks, in small bits and pieces to these stimuli, and then increase it gradually. Are you with me, Mustafa? Have you
Yes, doctor. Who are these specialists, doctor? Who does this work?
are a specialist. They are a specialist for this team. Even they are occupational therapists. They are the ones, you know, who are
Okay.
involved. Then there are for the behavioral therapy, psychologists are the one who are involved. So it's an entire team who are specialized in treating. However, if there is any other one, I would really, it's a good opportunity for
Okay.
me
Yeah.
about the other team members who helps that kind of people, you know.
Okay, doctor. So, doctor, just I want to know, like, how we will diagnose these children with autistic
Yes,
spectrum disorder, and why it
that's a
happens. Yeah.
very good question. Because it's such a dilemma till now, you know, how to diagnose autism. So do you know if any blood test we can do to diagnose autism?
No, doctor, I don't know. Is there any blood test also for
There is no
diagnosis?
blood test, right? Right, okay.
Okay.
Right, Mustafa. There
Uh,
is no blood test. It's actually a screening tool, you know. This is a clinical diagnosis, right? So there are screening
okay.
tools for if it's a toddler, then we have something called as the MChat, which is the modified child, uh, modified. Can you help me with the this? It's a assessment tool, modified childhood assessment tool for toddlers. Then if it is another is like cars childhood assessment for cars is another screening tool.
Yeah. Childhood autistic rating scale. Is it
Yeah,
like this, doctor?
yeah.
Okay.
So there are various questionnaires, you know, basically which have to be filled, which is assessed, which is by observation of the parents as well as therapists who see, and then they classify whether this child has autism or does not have.
Okay. So, any cause, doctor, like we can prevent or something? Any cause is there for this?
Well, can you think of any primary cause or anything? Like, have you read anything about this?
I heard like some syndromes are associated with this,
Right,
but
right. Which
what is the
one?
exact cause? I don't know, doctor.
Well, this cause is generally it's not known why does it happen. There is some genetic association. Some autistic spectrum disorders have absolutely no will be without any syndromes. A few syndromes are associated with autism. Can you help me? Which ones?
I heard Downs. I know that.
I'm finished. I told 6 minutes left. Did you both hear?
Yeah,
you
I heard it. I heard it.
2
Oh my
times
God, I didn't hear what.
loudly. Then I wrote in the chat also. See the chat?
Yeah,
Oh
yeah.
my,
I heard 3
I'm
minutes left. You told.
I told.
Actually, this
so
is
sorry.
what happened in the exam.
Jeddah exam.
With the exam. Yeah.
Yeah, that's why she don't. Why I'm thinking why she's
No, I'm not.
summarizing.
I really missed it, Dr. Noor. I don't know why am I missing that 6 minutes. Thank God in the main
I
online
told
exam.
loudly also 2 times.
No, just hold on, Dr. Noor. If the role player keeps on asking questions, you cannot summarize.
Yeah. Yes, Dr. Faiza. Actually, in the Jeddah, the senior examiner told them somehow you have to summarize. So you have to stop somewhere this like no role player.
Telling that
And,
why
yeah.
don't we arrange meeting? Why can't we do seminar?
Yeah.
You can come.
I'm so sorry. I was thinking, why is it going so long? Why is the 6 minute this bell rang? I thought it's the 6 minute bell.
No problem, no problem. Anyways,
Okay.
if you had
I
ended,
think you, Dr. Noor, you should come like the invigilator in an online exam. Show your face, okay? 5, 6 minutes done, and then just go back behind the curtain.
Okay, we'll do one thing. Just summarize now.
Okay, I'll just give
How
me a
you
minute.
would have told him in the last. Just conclude
Okay,
now.
I'll okay. Just Dr. Sridevi, just continue, and in a minute I will just come.
Ask,
Yes, Dr.
ask some question to her so that let's see how she will continue.
Yeah, I
I'll
will
cut you.
ask. Okay, so one more question is there, doctor. Actually, I have problem with the communication with friends and some of the distant relatives. So do you think I have autism?
Well, doctor, the way you're communicating with me, I find it difficult to assess that. However, I am a pediatrician. It will be really great, if you go to the adult assessment to see whether you really fall into the autistic spectrum disorder, right? And Mustafa, I know this is a very vast topic, and for it to get covered in a day is really difficult. So what do you think of having another meeting to address your remaining concerns?
Yes, doctor, it's fine, no problem. We can do it.
Okay. Mustafa, could you please summarize for me what we have discussed?
Yes, doctor, we discussed about autistic spectrum disorder. What is it and what are the domains, all 3 domains. Also, we talked about like little bit about how we diagnose the screening tools. And also we discussed about the sensory integration, therapy and all, by the occupational therapist. Yeah, these things we discussed and some risk factors.
Regarding your concern, even I am concerned if you really feel that you have this, I would I would advise you that you would take the proper help to know that. However, things should be better, and I would really like that you would present this in the seminar, in one of the seminars. Topic, is it fine, Mustafa?
Yes,
Can you go ahead?
yes, doctor.
Yes. So it's great, Mustafa, having you over here and having such a good discussion about this. And I really love the concern that you have towards patients. Okay. And thank you very much.
Thank you, doctor.
Okay. I think it went well.
It was very nicely done. It was very nicely
They will
done.
give the feedback and then we will ask our questions. All of you, if you have any questions, keep reserved. After the feedback, we will answer. Just open your mic, Dr. Sridevi.
Yeah, so yeah, Dr. Mujma has done very well actually. See, initially she took the like any attender, she asked also about previous knowledge. And yeah, so the 3 domains she told, it was good what she told. Actually, I don't have comment. What I will comment.
Okay.
Okay. Yeah.
Okay. She was just, I want to ask her regarding this blood test. You are just testing her, huh?
Just testing her, and
Yeah.
I then realized with the RCPS, I should not be doing all this nonsense.
Yeah, I don't know. Maybe they will. I don't know if the examiner will not hear you completely. He may catch in a wrong way. Just be careful. You can just tell him the other way. I feel it's a functional disorder. It's not a structural disorder. So just by, as you said, just by observing the child, it's a clinical diagnosis by observing the child, and you have some rating scales in which you will be rating the behavior of the child, and then you will diagnose. Okay. I think otherwise it was okay. Faiza has some comments. Let's
Yeah,
see.
actually, it was very nicely done. Nothing was left. She was very polite and she was actively involving the role player. That is very nice, a part of the education, especially in a medical student. The only Muzna I would suggest you is that speak less, okay? Speak less, like try yourself. I mean, it should be a dialogue, not a monologue. And always remember, Muzna, you always do communication very nicely, in a very loving and a humble way, like a very nice teacher. But speak less, like let the role player speak up. I mean, mostly like they say, like speak only for 30 seconds, not more than that. Okay. This is where you get stuck that you cannot finish your scenario within 6 minutes and then you get carried away. This is what I was doing.
Yeah.
That is
Jazakallah khair, Faiza. I know I really have to force myself not to speak less.
because
That's
this
my
is the
problem.
only way you can remember that 6 minutes are left. Otherwise, you go like it seems like you're doing it from the bottom of your heart. Now, whenever you do a communication, that's very nice. Like you're actively involved in it. But when you get involved in something from the bottom of your heart, then you forget the world, and the world is 6 minutes. Okay.
Jazakallah khair.
Okay. So, Dr. Muzna, if you don't mind, can you explain this sensory disorder? What is this?
I just read that in
Yeah,
the
yeah.
evening. You remember I told you, Dr. Noor, please give me some notes.
Yeah, because no, today I was
And
whole day busy. I did not have the time only. So I couldn't go through it. I will share
I
the
have
report. Can you explain?
Yeah, see, this is, these children, especially the autistic spectrum disorders, especially the Asperger's one, as per the previous note that I had made, they have these sensory, although it's not written anywhere, but Asperger's you get a lot of all these sensory processing disorders. So whatever, as Dr. Sridevi rightly said, just remember all the sensory organs that we have, smell, touch, hearing,
Vision.
and, vision okay, vision also, bright lights, right? Exactly. So all these things, either they are highly sensitized or they are hyposensitized, so oversensitive or hypersensitive. So the examples, if they ask, the problem is in this scenario, what had happened, I heard, was that most of them got carried away in explaining about autistic spectrum disorder. Okay. But the role player had these two things, which Dr. Sridevi did towards the end, that am I autistic? This was his agenda. And the first agenda was discussing about sensory processing disorder. Hence, I initially asked that, what do you want to learn? Do you want to know about this? Or that's why I quickly completed the autistic spectrum, because this would take time. So if the person says, no, I know autistic spectrum, I just want to come to the agenda quickly about sensory processing disorder, so they will be oversensitive. Like if there are certain clothes, they may really any clothes, cotton cloth or any cloth, they will just not find it good. They will find it too scratchy or too itchy. Any light, they will find it very bright. Anything, any sound, small sound is there, but they will not be able to tolerate that. Or some food texture, if it goes in their mouth, they just feel like vomiting, and that kind of a thing. So this is oversensitive. And undersensitive, they have that they can means any stimulus will not have that effect. For example, if I go round and round and round and round, I'll fall. They will not fall. They will like to do that. They are undersensitive to that. They will
Yeah,
jump,
I mean, I would like to add on, like you see, like when you feel the water in your hand, you can feel this is water. When you put some rice in your hand, you feel water. I mean, you feel the consistency of the rice. Na, they don't have this perception, and these people are very picky eaters. Like because they don't have the sense, they cannot sensitize themselves to the taste. That is why. Like they have special behaviors. That is why sometimes they will pinch you a lot, like
Or sometimes they
just to
will
feel
chew
the
on their hand because their sensory sensation is so less. You'll see them chewing their hand, banging their head, because their sensation is not intact. They cannot feel that pain that is there.
Okay, beside banging the head hard, they will not feel the pain. This is
They
what.
will not feel that pain. That
This
will be
is
there.
hypo.
This is
In
hypo,
hyper,
undersensitized.
in hyper, they don't want like any even small painful thing. They don't want. Like here, the vena puncture was difficult.
Yeah.
Can be in both the way, hyper or hypo, both.
Hypo. So that has to be told, and then in a nutshell, just 2 or 3 points you tell, that is enough. And the parent, how you diagnose, if you come to know, they will recognize that the child's behavior is not, the parents themselves will come with all these things, telling you, and the therapist will ask you questions about all this. And this has sensory integration therapy. I'll just read out what is it. This type of therapy uses fun activities in a controlled environment. With the therapist, your child experiences stimuli without feeling overwhelmed. Generally, a little stimuli will make them feel overwhelmed, but they will use play therapy. Slowly, they will expose so that the child does not feel overwhelmed. He or she can develop coping skills for dealing with that stimuli. Through this therapy, these coping skills can become regular and everyday response to stimuli. Now, there's something called as a sensory diet also, okay, for these children. Diet does not mean food, does not mean eating. It is just a activity program that is given to the child, diet that every day 10 minutes you should walk okay, or at a time
sometimes they advise
child
mother to
swing.
take them to the seashore and take them to the water, feel
Huh.
that water, put
Feel
them in
that
the
water.
bathtub, put them in the bathtub and feel that water. And sometimes they get these special in abroad now, they have colored food particles, but they have specific senses, like colored rice would be there and colored popcorn would be there, just to feel this is popcorn and this is rice. And they have to do this therapy repeatedly at home and at the center as well, that they will give them the same stimulus there and then for 10 or 20 minutes, and then they will see that how the child is
How
going.
is even like audio stimulus, like putting a headphone and show any music that is given to them.
I mean, sometimes they are so hyper. I mean, they will run away from a crowd. Like they get claustrophobic and they will run away from the crowd and hide themselves in a corner. And sometimes they are so hypo that sometimes they will walk on the road and they might get hit by a car. This is like that. And when you bring them to the hospital, sometimes they are so hypersensitive, they won't let anybody touch you. And when if they are in a life-threatening state, now, if a lot of people surround them and they try to like forcibly put a cannula or forcibly put a thermometer, they will go nuts because they cannot run away, and they will have to be controlled simply by letting go of everything and doing a soothing thing like that. I mean, it's very difficult and very painful miserable part of autism if it's very severe.
And Dr. Sridevi, you asked me a question, who does this? As far as I know, it's occupational
This is
therapist.
occupational
It's
therapist.
by
This is occupational
therapist.
therapist.
Yeah.
Occupational therapist. Yeah.
And
Nobody's
I just want to say, like, this can happen with simple autistic also. It is not only with Asperger. Okay.
Not with that. Yeah, it can happen.
Yeah, I
Simple
have a
autism
question.
spectrum.
I have a question. Why the role player asked this question? Do I have autism spectrum disorder? Why was this
That
question?
Because that is what is asked in the exam.
But Dr. Sridevi, I'm going to tell you one thing. That person even behaved autistic. He was not
I
looking
know.
into the eyes
There is
of
no
the
eye-to-eye contact. Here we don't have video, so we
videos.
can't,
Yeah. So that's why I said you're talking so well.
Because I thought like literally this is like a pinching the candidate. Now, okay, tell me like if I have autism. So I was a bit like, why is she asking this question?
This is what he asked in the exam.
Ah. Anyway, but Muzna, it was very nicely done, and Sridevi, the questions were really nicely asked. Like, it's sometimes a blessing if you get a role player who knows what to ask.
Alhamdulillah.
Yeah.
No, actually, but I'm not telling these people the cases what they will get. I just told that we will do some previous scenarios, but I'm not telling who is getting what. Like
This
you did not know, Faiza, you did not know that Rohel.
No, I did not know. I did not
Like that,
know.
the same thing. They will not know which case they will get.
Yeah.
It's
But it's a wonderful effort because this year exam is going to be was totally different. Like the headlines they were going towards the neonatal guidelines a lot in the videos and communication, and then they brought up these things which were mostly not done. Like theoretical portion was mostly added as compared to the practical portion. So like it's going to be a more theoretical exam if somebody gives this exam till this year, or if like hopefully the COVID goes away and we have some physical patients like that. Yeah.
okay, just 1 minute. Okay, we are done with this scenario. Anyone has any questions to be or any comments, please go ahead.
Do you have any further scenarios still going, Dr. Noor, or it's going to be the last one?
No, I think we will do one more and end, because I want, whenever I am free, I am trying to cover maximum, because some people are going for exam this month end, and another also, if we cover how much ever, it will be helpful for us also.
Okay, fine,
That's
fine,
why.
fine. That's good.
One more scenario we will do and we will stop.